It's 9:16. So many lives are affected by cancer, and there's little, if anything, you could do to prevent it.
Yeah, but this type of cancer today that we're talking about is actually preventable through screenings. And Dr. Brian Van Linda is the gastroenterologist at Trinity Health, New England, and is here to talk about the importance of colon health. Welcome here to CT Style, Doc.
Thank you very much, Ryan.
Absolutely.
So
thanks for joining us.
Not a particularly easy topic to talk about, but it's an important one because it is preventable.
And there's no better time to talk about it. Since 2002, President Clinton designated March as Colon Cancer Awareness Month. And I think he did it with the explicit intent of demonstrating how common colon cancer is. It's currently the leading cause of cancer death in non-smokers in the United States, and the second leading cause of cancer death in individuals who do smoke.
And men and women.
In both men and women, and it is, in fact, preventable. If you think of the other common cancers, such as prostate cancer or breast cancer, the screening techniques there do not prevent a single cancer. They only hope to detect it early. But with colon cancer, the current screening guidelines recommend a colonoscopy to identify a small polyp, which in a certain percentage of time will eventually become a cancer, but it is aborted if it's removed. And so it's a preventable form of cancer.
And when should people get screened? I mean, is there an age?
Yeah, so the age does depend somewhat on your risk factors. So assuming that someone is asymptomatic, meaning they're not anemic and they're not bleeding, and assuming that someone doesn't have a family history of associated cancers or polyps, no family history of colon cancer, no family history of polyps, the ordinary age would be at age 50. Among African Americans, it's 5 years earlier at age 45.
So it is hereditary?
So all cancers have some degree of hereditariness. You know, there's an interesting recent study out where they've tried to identify what's the randomness of it all, what's the hereditary aspects of it, and what are the modifiable risk factors of it. And probably with colon cancer, 70% of it is probably random. It's just random bad luck during the cell turnover. There are mistakes made, almost like typographical errors when you're typing out your resume. And about 20% is related to family history. You've inherited some genetic predisposition that leads you to increased risk. And probably 5 to 10% is due to modifiable risk factors like smoking, obesity,
How about food?
activity.
I mean, are there things that we can eat or do differently in our life to help prevent this?
The interesting about food is the data, you know, the studies here are very difficult to do. For instance, if we wanted to really know the effects of your dietary intake on your predisposition to colon cancer, we'd have to know what you've been eating since you were born.
Oh, okay.
That study's not going to get done. So consequently, you get these studies that are said, we followed 10,000 people and we asked them about their diets and we followed them for 5 years. And the studies on folic acid, vitamin D, calcium, you can get whipsawed. You can get whipsawed. One day you say they're good, one day they say they're the next. Probably the best way to put this, of the modifiable risk factors, and we can't pick our parents, we can't prevent randomness, but I think what you want to do, stay slender, be physically active, eat a diet that's low in red meat and high in fiber.
And get a screening, very important.
And then absolutely get a screening. And, you know, 1 in 20 of us will get it. And, you know, when you look at the statistics and you say 135,000 people get colon cancer, 40,000 people die of it, it almost sounds otherworldly. But if you think about it on a personal level, and that's easy for me to do because my mother-in-law died at age 56 of colon cancer in 1982, in the era before screening. My own mother lived to be 97 and died a couple of years ago. And when I think about the differences, you know, my mom participated in all the graduations, all the marriages,
It's a big difference.
all of the fabric of our life.
Very important
my
thing to
mother-in-law
do.
was not there. And I
Don't
think
miss
you
out.
see that once, you think about screening.
Make sure you guys get screened.
Thank you so much for all the information. You can check out trinityhealth-ne.org for all the information there. Stay with us.